Michel Conteh. We in the Secretary General for Sierra Leone Association of Social Workers. As coincidentally, tomorrow, the Sierra Leone Association of Social Workers, they host a conference wherein they commemorate the World Social Workers Day 2024 in Makeni on the theme, the role of social workers fostering a shared future for transformative change in child protection and welfare in Sierra Leone. Michel, first of all, my pleasure for getting on the program this morning.
Good morning.
Good morning.
Ladies and gentlemen. Good morning to viewers.
You can't meet a conversation we get for with the intake of drug abuse in the country. You can't talk of such conversation without linking it to the work of social workers.
Absolutely.
And that's more the reason we get for mix up the conversation at this particular moment. Waiting now on a position at this particular moment, taking into cognizance the amount of young people. We say young people because now the pictures we see on a daily basis.
It's the majority.
But even the aged self-day into drug abuse. But waiting on a position at this particular moment.
All right. We are deeply concerned as an association. And the good thing of this is that we had started this conversation about 3 or 4 months ago, where we pull a position as an association where we get fulfilling solution to the proliferation of drug abuse in the country and the effect where they get in society. For we, it was a position that this drug addiction in the country get a possibility for me to get a shattered future of a country like us. In fact, amongst other reasons, we are celebrating a month as social workers right across the globe, which is March month. Amongst many reasons, we decided to say we are going to put various social issues into different activity plans. And the month started on the 1st of March with a symposium at Rabi College. The good thing is, the theme we deal with by that particular symposium day, who collaborated with the Social Work Society of Rabi College, was dealing with drug abuse and mental health. And as part of the conversation, as part of the discussion, the Minister of Social Welfare, Madam Nelwas Kaminti, was very clear that the Ministry of Social Welfare takes this thing as something very serious. In fact, that's one of the reasons why now they don't get a new directorate on psychosocial support, where basically they deal with the people then, where they go through their transitions transition, though negative like this, when at the drug abuse, or make it deal with them and give them support at the end of the day. My brother was talking about the roles of social workers, and he was emphasizing on the psychosocial support. The psychosocial support is basically saying that once we have a situation where people get addiction, coming out of it for us as professionals, dealing with the different models and strategies, we know that it takes a time. We will call withdrawal. The withdrawal process is basically saying, well, as much as we are dealing with this particular drug and you want to let people left out, it is highly possible, say, if not only for you just capture them and go back them to long and put them at a particular secluded side, it's possible, say, they may not be living it. It is also possible, say, if you just decide, say, no more, we are only going to deal with the production chain of kush as a specific drug, it is possible, say, there may be an arrival of a new drug or a manufacturing of a new drug. You remember, say, not to kush this thing starts with. We don't hear about 225, we don't hear about Pampas, we don't hear about ecstasy, acid, and there are many things of it. And every now and then we hear about new graduation of drugs. So which means there are underlying issues. When we had a position about 3 to 4 months ago, we said few things, and one of which is that the religious people can say an idle mind is the devil's workshop. There may have been social issues where they make people engage into the thing there. And when you talk to most of these people, one of the things where they say, then they use drug as a way for forget about their souls.
Stress, yeah.
And they're going into poverty and their idleness. Question is, what are we doing as a country for that we make sure, see, the people are really engaged? You may have underemployment, you may have unemployment, you may have employment. We can take it as a stage. If even we have a lot of people who are unemployed right now, We can go to underemployment, but still have something and somewhere to engage. Then from there we go to employment, and you make sure them be very comfortable. But again, have we also thought about how then drugs that they take for come inside the country? We drug experts already say it's a mixture of different things there. Then things there should be identified. So because we think that they should be identified as an association, we are now thinking about conducting evidence-based research to understanding what it really means or where is it coming from for letting things that are continuing for that happen.
With the aggressive nature at which we see the intake of them drugs here we don't talk about, who say a place on us an association? Because we get a whole lot of work for do in terms of you guys rendering services and ensure say then people are rehabilitated back to society. Who say this one puts on?
So you cannot talk about rehabilitation if you do not have the infrastructure. Infrastructure could mean say are there policy directives around rehabilitation? Are there state-owned or private-owned rehabilitation centers that are equipped with not only the materials but also the human resource? This is where you try to get on board social workers who are experts in mental health and also liaise with the medical field to ensure that these people then try for flush them out, as we can say. And once you flush them out, you also have to take into consideration the rationale behind them going into this particular endeavor, which is the intake of drugs and its abuse. And as I mentioned earlier, that may have been the universal statement of it as a way to forget about your sorrows. But there are many other people who may not be in poverty but are also engaged into it. Have we thought about peer group pressure? Have we thought about just satisfaction of societal needs? Have we thought about saying, well, we only want to feel belong in a society? So it's not a one-size-fits-all approach. And that's why we continue to say, put the right people in the right place when you set up the infrastructure and not feel say any other person can just grab and say, I am going to make sure that we only advocate around drug abuse and the withdrawal of these drug victims. Some of them are victims, some of them are only doing it for fun. How are we going to address some of these things? It only takes one, taking into consideration the infrastructure, the rehabilitation infrastructure, and it's not only about the building, but also about the right human resources. Come on board, bring on board social workers who have been experts into this, and let them help in ensuring that people who are into this drug abuse are talked with, are spoken with, are having conversations with, and make sure that they are coming out of it permanently, not temporarily.
So, as we speak now, the kush don't enter most of the universities. It is very clear that people we get huge potential for change this nation in the future. Don't already fall victim into this kush. How best one of the series for penetrate the universities? Sure, say when I engage students because it's all the mandatory things to go.
Yeah, the sad part in all of this, as you intimated, are the fact say the different facets of our young people are now being affected. Whether you're educated, you're not educated. Whether you didn't at the ghetto or you didn't at the university. And they get glimpses of also going out to the schools. What it tells you is that the network don't seem to be very broad. The network of the one that whether I can in the carry time, or whether I also the producer, the production and manufacturing or importation chain don't seem to be very broad. And action not seem for them be taken. Not so the knee-jerk approach actions that we're talking about. The approach where you go use for the one way don't be addicted, get will be different from the approach where you get for use for let others and only for use them. So you need for tackle one, the production, manufacturing or importation phase. Then also you need for tackle the usage or the end user stage. And my brother was talking about those who have been addicted. From a professional point of view, maybe one of the reasons why once you think, say, people are into it, then they decide, even when I put them inside on a house and they decide back for go or for go fair now, it's possible to say the approach that is being used need for be enhanced. Yeah, I started and stated about the withdrawal phase of how you deal with addiction. So if somebody don't use for take on like 5 pack or 5 stick, just grab one and say let's stop her. You understand? You can decide to begin deprive them of 2. If you deprive them of everything, what will happen? In body they yearn for them. And if you yearn for them, you get cause for like phenom. But if it take 4, you deprive them of 2, say 4 times a day, just begin take 2. So until after 2 weeks, after 3 weeks, they begin take 1. And gradually they left them by phase. That is an expert point of view, a professional point of view. You only need an expert or a professional for let you do that. For let you know, so for let you get the withdrawal phase for be done. You understand? So that's why we are asking and saying that the engagement of people who are professionals need for be taken into cognizance. Some of them say they are not only for just gap and talk say with the first push. If you cannot engage medical practitioners, if you cannot engage social workers, if you cannot engage policy makers at high and top level, it is difficult for make you bring an end to it. But also importantly, law enforcement need for come into place. But there is a way and there is an approach where you get for use for dual. If you only think saying that only violent way you get for dual, then I'm afraid people are going to go into hiding. People are not going to talk. Then by that means, the psychosocial aspect of it is going to be defeated absolutely and entirely. So the engagement of experts is also important. Then you come now to what we'll be talking around when we said something on, was it on 10th of October? One of the action points that we see was public awareness. Public awareness basically gets for deal with the area about people understanding what thing you think say get for be the future effect of taking it now. When I in the university students and need for no. Even when they are coming into it as a result of some pleasure or peer group influence or just satisfaction of society. If you let them try to know that once you decide to take this path, then you don't need to come up this path. Then because you don't need to come to the university, it's possible to say you may not end up with a better university grade or a better university result. You are only wasting your time. Then they would see a need to not go into it. But if you only feel says about, well, you will only get for craze or you will only get for short-term effects, they will definitely not feel say, well, so after 2-3 weeks, I just stay Salome. Yes. After 2-3 weeks, you get for done. So it depends on the approach, and it only has to do with the engagement of the experts and professionals into it.
So, Michelle, so I meant for understand, say, it's social work, so we get a whole agenda for this month that we've been having a lot of engagement on different aspects like climate change, drug abuse, and tomorrow is supposed to be about the child welfare and protection. This whole drug intake, it will surprise you for it's not just even how for say how should I say youth, the young people, adults or things like that. Even the school-going kids in the primary school, they are also involved, 14, yes, because 11, some of them then even start by they send them for go buy. And when they go buy, because it's not normal for even the civil they send picking them in those days for go buy cigarettes for them, things like that, the Maggie Jumbo, things like that, all this stuff. And now we don't come to push. And part of our agenda now for try for protect the welfare of children and try for ensure for they're led in the right path. So has there been any thought or will there be any engagement about such discussion into whatever it is that you'll be doing tomorrow?
All right. So the Sierra Leone Association of Social Workers, being a membership-based organization for social workers in Sierra Leone, they try for promote one the profession and two for promote social services within the social services sector and the social welfare of the population. Deemed it fit to follow join the world all over for celebrate the World Social Work Day. The World Social Work Month also, because the day they fall the 3rd Tuesday in March every year. But the whole month of it for we is Social Work Month. So because of the many issues there are many social issues there, we decided to, all right across the country, we are going to have different social issues being discussed at high policy level. Although we get the commitment of policymakers into these areas. As I said earlier, we started off with mental health and drug abuse, and where the Minister of Social Welfare made commitments from the ministry to see how best we can continue to have policy interventions on drug abuse and mental health. So tomorrow, which fortunately is the World Social Work Day, will be seated at Makeni, the University of Makeni Auditorium, with the Deputy Minister talking around the transformation of a society, with particular emphasis on child protection and welfare. This is important, linking it to waiting at the question you asked me. One, we need for protect the future, and we cannot protect our future if we cannot protect our children. Whether it's as a result of developing their social welfare as children, or trying to get a better environment, a protected environment for them, or trying for CISA, we build a future for them on a very innovative way, in a very innovative way. It depends on how and what's the government's agenda or what a society's agenda is. And now, because this drug issue is now becoming a menace in a society, it's definitely becoming a threatening aspect for the children itself. So we'll be expecting that the keynote speaker, who is Mr. Mohamed Haji-Kella, will be speaking around, one, waiting the ministry or the government to do for let we get a protected society for our children, waiting the ministry and the government to do, or how much they are liaising with other partners for let we get the welfare of our children enhanced, but also concerning this particular effect or concerning this particular menace that we are grappling with, which is drug abuse. We now get the tendency of even in order even go now the schools themselves, we get the majority of the children waiting, then they do now for link the Directorate of Psychosocial Support and Mental Health, and that of which, when at the work, where the Ministry of Children, they do, and how this children protection gets for billing, and how much infrastructure they don't create for let we get social workers and infuse as professionals and as experts into dealing with these social issues, for let we bring an amicable end to some of them problems there also. Because you deal with drug, you deal with children's protection, you deal with climate change, if you do not have the right people in the right place, which amongst others are social workers, you'd only be putting water into a basket. You'd only be wasting the state's resources. You'd only be having an opportunity for let people and only get kickbacks. But you'll not be having real solution to these problems. So we, as an association for social workers, we feel this is an opportunity for us to have long conversations, policy discussions into this, and then we get commitment from the policy makers themselves into dealing with these social issues. And we can start off dealing with these social issues when we begin to deal with the protection of our children and looking at their welfare and creating an enabling environment for let them grow. Because once they feel the need for we are having a protected environment, even the one that we don't big, we now the parents or the not too far from now a parent go feel we get this responsibility for we protect the children. And if we get this responsibility for we protect the children, then we need to be serious and responsible enough for we get an enabling environment.
Absolutely, yes. Your take on the comments.
Just to take on the comments and as
well, especially on the side where say instead of rehab, they will be involved in agriculture, maybe get their work for them.
So I think one thing that we don't be achieved in this conversation, and the fact that people are gradually getting the public awareness, the much needed public awareness. Whatever be the case, people then get foresee the reason see ways until they see the best way for you engage with other people. It's not to the best result to give you at the end of the day. I also want to foresee, thank you so very much for places like House of Happiness, for we then take the lead for do them kind of thing there, at least for provide a safe home for the one there would they be engaged into drug addiction and something of the sort. Well, we can have different approaches. You can still take them to the farm, but if you know totally and absolutely get them rehabilitated in the best ways, it's all about investment for nothing. You understand? So again, back, if you rehabilitate them and you not engage their minds, at the end of the day, it's similarly investment for nothing. So we can have, the two things can be right at the same time. It's a matter of knowing when and how to do them. So I think, say, the strides that are being made to say, one, they could be engaged in employment, and also they should and must be rehabilitated, can both go at the same time and be achieved.
Okay.